Ever wondered how public health crises have shaped political landscapes? Well, history is brimming with instances where a public health crisis has dramatically altered the course of politics. The connection between public health and politics is more intertwined than one might imagine. Public health crises, as disruptive as they are to the societal fabric, often result in significant political shifts. They don't just expose the fault lines of a nation's healthcare system, but also the strengths and weaknesses of its political leadership. Let's cast our minds back to antiquity when public health was a matter of survival for communities. Rulers were expected to provide clean water, sanitation, and protection against epidemics. Their success or failure in doing so could mean the rise or fall of empires. This was, in essence, the birth of politics in public health. Fast forward to the modern era, and we see that the stakes have only gotten higher. Public health crises now have the potential to shake up the global political order. They can serve as catalysts for policy change, force governments to rethink their priorities, or even lead to shifts in power. A prime example is how the AIDS epidemic in the late 20th century led to a global reconsideration of healthcare policies and a renewed focus on public health. The political ramifications of public health crises are not always immediate. In fact, they often reveal themselves gradually, over the course of years or even decades. Yet their impact is undeniable. They can reshape political landscapes, redefine national identities, and even redraw the world map. Remember, the relationship between politics and public health is not a one-way street. Political decisions can either exacerbate or alleviate public health crises. A government's response to a health crisis can be a litmus test for its competence, revealing much about its priorities and values. So it's clear that public health crises and politics are inextricably linked, each influencing and being influenced by the other. Understanding this connection is crucial to navigating the complex landscape of global health and politics. Let's dive into history and examine some of the biggest public health crises and their political repercussions. Picture Europe in the 14th century, a time when the Bubonic Plague, also known as the Black Death, reared its ugly head. This was an era marked by feudalism, a socio-economic structure where the nobility held lands from the crown in exchange for military service, while the peasants, known as serfs, were obliged to live on their lord's land and give him homage labor and a share of the produce. But then, in the blink of an eye, the Bubonic Plague struck. The plague was a grim reaper, cutting down 1/3 of Europe's population. It was indiscriminate, affecting nobles and serfs alike, but the loss was felt most acutely in the rural areas where the majority of serfs lived. This created a huge labor shortage across Europe. Now you might be wondering, how did a labor shortage lead to the downfall of feudalism? Well, the answer lies in the power of supply and demand. With fewer serfs to work the land, those who survived found themselves in an unexpected position of power. They could demand higher wages and better working conditions. They could even move to cities, find work in burgeoning industries, and start to accumulate wealth. This was the birth of the middle class, a group of people who had more freedom, more money, and more influence than the serfs ever did. Their rise challenged the established order and the political structure of feudalism. The lords, desperate to maintain their status quo, tried to enforce laws to limit the wages of the workers, but these efforts were largely unsuccessful. The serfs had tasted freedom and prosperity, and there was no turning back. The political landscape began to shift. With the rise of the middle class came the demand for more political representation. The old feudal system, with its rigid hierarchies and obligations, was no longer viable. A new era was dawning, an era of early capitalism and modern governance. So, the Black Death, in all of its devastation, was a catalyst for a shift from feudalism to modern governance. Fast forward to the 20th century, the world was grappling with the Spanish flu. This pandemic, which erupted in the final stages of the First World War, infected nearly 1/3 of the global population and claimed millions of lives. The Spanish flu was not just a public health disaster, it was a political turning point. It exposed the glaring inadequacies of the healthcare systems in place at the time, particularly in nations where healthcare was largely privatized. The private sector was ill-equipped to handle the scale and severity of the outbreak, leading to a critical evaluation of healthcare accessibility and equity. In the United States, for instance, the flu hit hard. It overwhelmed hospitals, exhausted medical staff, and exposed the limitations of a healthcare system heavily reliant on private practitioners. The pandemic highlighted the need for a more coordinated, centralized approach to healthcare, sparking a conversation about the role of the state in public health. Across the Atlantic, the story was similar. In the United Kingdom, the Spanish flu's devastating impact prompted a re-evaluation of healthcare provision. It became clear that a more comprehensive, state-run health service was needed. This realization was a key driving force behind the establishment of the National Health Service in 1948, marking the advent of socialized medicine in the country. Many other nations, too, began to rethink their approach to healthcare. The Spanish flu catalyzed a global shift towards socialized medicine, as countries recognized the need for a more equitable, accessible, and coordinated healthcare system. Governments took on a greater role in healthcare provision, leading to the establishment of national health services, universal healthcare policies, and other forms of socialized medicine. This shift was not just about providing medical care, it was about social justice. It was about ensuring that healthcare was a right, not a privilege, and that everyone, regardless of their social or economic status, had access to the care they needed. Thus, the Spanish flu brought about a profound shift in health policies worldwide. It marked a turning point in the history of public health, setting the stage for the rise of socialized medicine and shaping the healthcare systems we know today. Now let's take a closer look at the late 20th century, a period marked by the HIV/AIDS pandemic. This was a crisis of unprecedented scale, reaching every corner of the globe and affecting millions of lives. But it didn't just leave a trail of devastation in its wake, it also sparked a global response that reshaped the world's approach to health governance. In the early days of the HIV/AIDS crisis, the world was ill-prepared to tackle such a widespread and complex public health issue. The virus did not discriminate, affecting people from all walks of life, irrespective of borders, class, or race. The realization was sudden and stark. Health was not just a local or national issue, it was a global one, demanding a coordinated international response. And so, in the face of this devastating pandemic, global health governance began to take shape. The crisis spurred the creation of new international health initiatives and organizations, all working towards a common goal: to combat HIV/AIDS and prevent future health crises of similar magnitude. The Global Fund to Fight AIDS, Tuberculosis, and Malaria is one such example. Launched in 2002, it was a direct response to the HIV/AIDS crisis. It brought together governments, civil society, the private sector, and people affected by the diseases to pool their resources and expertise. This collaborative approach was a landmark in global health governance. Then there's the Joint United Nations Program on HIV/AIDS, or UNAIDS. Established in 1996, it coordinates the efforts of 11 UN organizations to prevent new HIV infections, care for those already infected, and mitigate the impact of the epidemic. It's a testament to the power of international cooperation in the face of a global health crisis. These initiatives, born out of the crucible of the HIV/AIDS pandemic, have had far-reaching impacts. They've saved millions of lives, changed attitudes towards health and disease, and set the precedent for global cooperation in the face of public health crises. In the wake of the HIV/AIDS crisis, we saw the world come together, demonstrating the power of global health governance. So, what's the common thread in all these public health crises? If you've been following along, you might have spotted it already. It's the recurring theme of political change. Each public health crisis that we've discussed, from the Bubonic Plague to HIV/AIDS, has sparked significant shifts in political landscapes. Let's take a moment to pull these threads together. The Bubonic Plague, for instance, led to the fall of feudalism. This horrific sickness, which swept through Europe in the 14th century, decimated populations and destabilized the status quo. In its aftermath, the traditional feudal system crumbled, and a new political order arose, paving the way for the modern nation-state. Fast forward to the 20th century, and we find the Spanish flu. This pandemic struck a world already reeling from the First World War. The sheer scale of this public health crisis spurred countries to rethink their healthcare systems. The result? The rise of socialized medicine in many parts of the world. Then we have HIV/AIDS, a crisis that continues to impact us today. This pandemic underscored the need for global health governance. It led to the creation of international organizations and initiatives aimed at combating such threats on a worldwide scale. So, what does this all mean? It's simple. Public health crises aren't just health issues. They are catalysts for political change, powerful enough to shift power dynamics, alter policies, and even transform global governance. Each crisis leaves an indelible mark on the political fabric of society. They force us to confront realities we might rather ignore and push us to innovate, adapt, and evolve. And while the immediate focus is often on treating the sick and preventing further spread, the long-term implications extend far beyond the realm of healthcare. In the end, political change is an inevitable outcome of these crises. It's a testament to our ability to learn, grow, and make the best of even the most challenging circumstances. As we navigate through current and future public health crises, remember, they are not just health issues, they are political turning points.